All right, so we're looking at the adductor muscle complex here. And we're quite proximal. You can see in the middle of the screen here, this is adductor longus. Below that should be adductor brevis. It's slightly harder to see the different delineations of adductor brevis, but I might be able to convince myself that it's underneath there. Otherwise, we're looking at adductor magnus below adductor brevis, but right where the pointer is in that area looks like it is potentially a separate muscle complex, which would be adductor brevis. And then if we slide medially on the leg, we can see gracilis is that top skinny muscle. And then if you slide down the leg, you can follow the course. And it should stay approximately in that plane. I'm just going to grab more ultrasound gel to show you the course of it. And it gets smaller as we approach the knee, where it becomes more tendinous now in this portion. And then if we slide back up, back into the adductor complex, here we're at adductor longus again. And then I'll see if I can show us that fascial plane where it looked like we were seeing brevis. Yeah, I think that's brevis in there. So when you are looking for the obturator nerve divisions, essentially the anterior obturator nerve runs in that fascial plane between longus and brevis. And then the posterior division runs between the fascial plane, we can see partly there, between brevis and magnus. And when we are looking at doing a block, in this view, you would come from lateral to medial, so the right side of the screen. And so we can inject with the same poke to target the anterior and posterior divisions. So we would come from lateral to medial. So you can see here we'd come in plane and we would target the anterior division first. You're going to have a neuromuscular stimulator, ideally one that goes below 1 milliamp, to ensure that you're actually on top of the nerve, because you can see here we're mostly looking at the fascial planes. The other component you want to look for is using your color Doppler to look for the neurovascular bundle, and that is where you'll be targeting near, but obviously trying to avoid vascular injury. And then in this same poke, if you redirect at a steeper angle, then you can potentially also get that posterior division in the fascial plane beneath. So we're going to flip to the longitudinal view here. And you can vaguely see each fascial plane here. So the top one is our fascial plane where the anterior obturator division sits, right there where the cursor is. And then below that is our posterior obturator nerve division in the fascial plane between brevis and magnus. So the longitudinal approach, you can see we would go in plane from caudal to cranial at approximately a 45-degree angle. And you would aim first for the anterior division, which I'll show our cursor is that top right fascial plane. And then you would redirect your needle with the same poke to aim for that posterior fascial plane. And that way you can block both nerves within the same poke and have a quicker procedure. But essential to this, as I mentioned, is the stimulator to make sure that you are in fact close to the nerve.